Well, hello again. It's 7 o'clock and welcome back to SDS Free Thursdays on Zoom. We've started it in March, very early in the lockdown, and to be honest, I've now lost count what session it is, probably 16th, 15th, something like that. And we are very, very glad to see you all, to see you back, and really hope that your summer was good. It was a hot summer this year, and it's really good that it's slightly cooler now. And otherwise, I wouldn't have been able to be in my office because it was so hot, impossible to be indoors, and not much better outdoors. So anyway, this is our first session, and we are starting big with Professor Wendy Dryden, who you all know. And as always, I just wanted to remind you about some rules. Everybody is muted during our presentation, and we will take questions in the chat box at the end. We might take a couple of people on screen if you put your blue hand up. I can see Monica already has her blue hand up. Monica, if you can type your question in the chat box, please, I'll try to get back to you. So the presentation will be from Professor Dryden for approximately 20 minutes, and then we'll open it for questions. I'll just let you know straight away, our next session will be not next week, but in 2 weeks' time on the 3rd of September. 3rd of September, Thursday, 7 o'clock, with Dr. Andrew Beck. And he will be talking about therapist burnout and how to prevent it. I think we should start early for after the summer to prevent a burnout by the end of the academic year. And Andrew will be talking about that topic, and he is running a full-day course for us on the 16th of September. And then go into SDS News. I will put the full schedule of the events for September and October. We'll be seeing you mainly fortnightly, simply because we have enormous amount of other events, including Zoom events, on our schedule, and fortnightly is better than nothing, I think. So enough of me. I will very happily pass the microphone to Paul Grantham, my co-director, who will introduce our speaker and talk about a little bit about our certificate in single session therapy. Paul.
Thanks very much, Julia. Welcome, folks. It's good to see a number of you here today after the summer break. We are extremely lucky and very pleased to have Professor Wendy Dryden back again. Wendy actually gave a presentation like this as an introduction to single sessions therapy a number of weeks ago. Gosh, I can't remember, probably a number of months ago actually now. But we wanted to revisit it really, and we wanted to revisit it for a number of reasons. First of all, Wendy is always, in my opinion, full of interesting insights and ideas on things. So it's really to fill out what it is that he said previously in his work on this. But the other thing to probably say is that the first cohort of people who have trained on CSST1, which is a certificate in single session therapy. That particular cohort is just completed. We have a second cohort, which is nearly full, I think, which is starting at the end of, if my memory serves me right, I think the end of September. And it's really to really promote really and to make you a bit more aware of what we actually think is a really, really important development in the therapeutic realm, really. I won't say too much about it because Wendy's going to open up on this obviously in detail, apart from to say that for a number of reasons, SDS has decided to partner with Professor Dryden on this, because we actually see SST as being particularly important at this particular time. we are already experiencing, and will no doubt see grow, a massive demand relating to mental health problems in connection with lockdown, in connection with COVID, and people who have pre-existing mental health problems for a whole variety of reasons have seen those problems escalate or get worse, or for some individuals, those problems have probably been managed to some degree before lockdown occurred, and they've sort of escalated again once that's happened. So we are already experiencing what I've described elsewhere as a tsunami of mental health problems. And the reality is that no matter how many therapists you have, and no matter what modality you actually work in, it basically ain't enough. And that one of the reasons why we actually had to see it as being very important to promote this further is basically because we feel that a totally different model of service delivery is very important, and that's why we at SDS and Professor Dryden got together to push that through. I see in the chat box that David, who was part of the first cohort, is here today. Welcome, David, and welcome to everybody else who basically would like to learn more about this. So I'll say no more, really. I will pass you over to Wendy. If you are not familiar with Professor Dryden, which I'm sure that the vast majority of you are, Wendy was the first professor of counselling within the UK. He is the author of over 200 books. I never give an exact number because there are new ones coming out all the time, and my figures will always be dated. And I'm probably going to get this wrong as well. He is the author of 4, and he's probably going to tell me 5 in a minute, but 4 books specifically on single session therapy work. So no more from me, really. I'll pass you over to Wendy, and really pleased to have you here again, Wendy. It's over to you.
Thank you very much, Paul. My mother once told me there's no point having a trumpet unless you blow it. So I'm going to blow my own trumpet. It's actually 10 books on single session therapy.
Ah,
so you're 6 behind me. Anyway, that's not the point. My point this evening is to really say a little bit about single session therapy and why I think it is important to train in it. Now, I have really done a number of training courses in this country before COVID, going around Northwest England, Scotland, Southern England, Devon, because there is a growing interest, or there was a growing interest anyway, in single session interventions. And my goal was really to actually say, well, look, this is what it is. Let's talk about it. Let's see, you know, whether it is something that you could incorporate into your service delivery. Let's understand it. Let's understand its potential. Let's see what it can do and what it can't do. And that's fine. But what I was a little bit concerned about is that people were leaving these 1 or 2 day workshops, kind of considering themselves that was sufficient to practice as a single session therapist. And I was a bit concerned about that. And that's why I approached Paul and Julia and said to them, look, I think there's real potential here to offer an opportunity for people to have a thorough grounding in single session work so that they can really understand what it is to really to come up with all their, what I call doubts, reservations and objections. And you may have many doubts, reservations and objections as people do, because this way of working challenges quite a bit of established thinking and practice in the field. So I approached Paul, and Paul and Julia were very kind enough to actually help and facilitate my thinking on this issue, and we how we developed a certificate in single session therapy. And also we've developed an association of single session therapy, which has two main aims. One is to encourage the understanding of single session work. And the second thing is to lay down some professional guidelines for what is the minimum criteria that you'd need to actually be accredited as a single session therapist. Now, before I actually come back to that, let me just say a little bit about what I think single session therapy is and what it isn't. Strangely enough, even though it's called single session therapy, it is not just one session and that's it. It is an intentional endeavor in which the therapist and client meet with the understanding and hope that the therapist will help the client to achieve what they would want to achieve so that they can move on, get unstuck, take a few steps forward, which they could then take part in their journey independently. On the understanding that more help is available. So there's always this sort of kind of tension between, let's see what we can do in this one session and more help is available. So that is what single session therapy is. It's a mindset. It's not an approach called single session therapy. It's a mindset. It's a way of thinking about delivering services, and it's also a way of organizing one's services so that one can help and provide help at the point of need. And as Paul pointed out, we are going to be facing a tremendous need for our services. And you know, if we go about things in our traditional way, if we respond to somebody saying, well, let's put you on a waiting list so that we can assess what you need, and having assessed what you need, let's put you on another waiting list so that we can give you what you need. That's not the way to deal flexibly with, you know, things at the moment. We need to provide help at the point of need rather than at the point of availability. Single session therapy and its associated mindset, I believe, is one way of doing this. So, so one of the reasons I think that it's important to train in single session therapy, first of all, strangely enough, people don't understand this, that the most frequently occurring number of sessions that people have in the public and the charitable arena of organizations is 1, followed by 2, followed by 3, etc. And we're not, as part of our training, geared up to help people within that particular short period of time. So single session therapy training is really important to introduce you to the mindset, to have you fully engage your doubts, reservations, and objections, and engage in a dialogue so that you can understand what single session therapy has to offer without really disrespecting other mindsets. So you can have a single session therapy mindset to the work, you can have an ongoing counseling mindset. So that's important, that each way of working should be respected, and each way of working needs to be the focus of training. Now, quite a bit of our training is based around the idea is that when somebody comes to see us, we need to assess them, we need to do case history, we need to do a case formulation, and then we can offer the best possible help based on those activities. And look, I'm not in any shape or form saying anything bad about those activities at all, because within an ongoing therapy mindset, that's fine. But, we don't necessarily have to provide that for everybody, because as the data shows, most people want to be helped immediately, and if you can help them quickly, that is sufficient for a large number of people. You know, people who actually come along for single session therapy, for 50% of those people, that is sufficient for that group of people. For the other 50%, further help is available. So you're actually not depriving anybody of help. You're making sure that people get the help that they need, that people who can have and get the help that they need from one session can have it and don't have to wait a long period of time for it. And people who need more help can actually have it, because that is what has come out of that particular first and single session. Now, single session therapy is not an approach like person-centered therapy is an approach, or CBT is an approach. It's a way of thinking about therapy, and it's a way of delivering services. What that means is that anybody from any orientation with the right mindset can bring what their orientation has to offer to single session work. But that needs a forum for discussion, and that needs a forum for training. My own experience has been, if you don't have that, then you have, for example, a group of CBT therapists saying, oh my God, I've got a 10-session protocol. How can I mush it into one session and provide it to the client? And the answer is, you don't. That's not the way of actually going about things. There's no concertinaing, if you like. There's really an important way of actually saying, look, single session work has its own framework. It has its own strengths. It has its own potency. Let's see if we can use its potency. One of the things that it really does its underpinning is that it's based on a strengths-based model. And so we're looking at what strengths are people bringing to the work? What strengths are we bringing to the work? Rather than the more traditional disorder-based model. Now, one of the most frequently asked questions is, how can you do single session therapy with, and then ... and there's a whole host of disorders. Now, in single session therapy, we don't think like that. It's not part of the mindset. We think of people as people coming to therapy for help with particular problems. They may have a number of problems which they may need help with ongoing, or they may have a pressing problem, which if you can help them with that pressing problem, that is sufficient for them at that point of time, so that you don't waste valuable time doing an assessment, a case history, a formulation for somebody who actually only wants help with their pressing concern, and that's it. And finally, I think the two main reasons for training is this, that good training in single session therapy, and that's what I think I'm providing under the auspices of SDS, is based on skills, practice, and feedback. You will have an opportunity to work with one another within a single session framework live and get feedback from you. Have an opportunity to practice with your peers before that. And finally, and most importantly, I think, supervision of actual casework is so important, and that can only be done within a training course. So for those reasons, I would say, of course, you can go to a workshop, learn about single session therapy, and then practice it. But I don't think that is the most effective way of actually going forward. It is based on the idea that if you're trained to do something well, you're more likely to do it well than if you're not. Thank you.
Thank you. Thank you, Wendy. Now, I wanted just to say that we have quite a few people who attended our first session on Zoom with Professor Dryden. And I received some messages from people who said that they are, even from that very short session on Zoom, they've learned something, and they've learned the elements and approaches which they're trying to incorporate into their practice. So even that short presentation on single session was beneficial. And of course, having the full course with Professor Dryden will affect you in much stronger way. So if I ask you to type your questions in the chat box, please. And the first question here is from Kirsten Wendy. Is single session therapy of benefit to children?
Children of what age, Kirsten?
Right, Kirsten, question back to you. Children, what would you say, Wendy, if you were breaking it down for age groups, what would you describe?
Well, look, I mean, I would say that it's interesting that within this country, we're much more likely to see children and adolescents on their own rather than within their family context. In Canada and Australia and America, there's a much greater tradition of actually seeing children and adolescents within a family context. And there's a great tradition of actually doing single session work within a family context. Having said that, there is certainly a body of work done in America. Jessica Schneider, for example, has done a lot of work on offering online-based, computer-based single session work around the idea of a growth mindset for adolescents. That's very exciting work. So I think, yes, single session therapy is potentially useful for all kinds of age groups.
Well, Kirsten actually explained a little bit about her question, and she says that situation that concerns her is that if we did a single session for somebody and then they wanted to come for weekly therapy, but we didn't have availability. So basically single session and they're keen to continue and we can't offer it. How would you handle that situation?
Well, I think that's a very good question. I mean, I think that the point is that single session therapy works best within the context of other ways of delivering services. Now, I think that there are, when people say, I want weekly therapy, well, I would say, well, what do you hope that weekly therapy is going to help you to achieve? In other words, rather than be focused on the process, I would help them to focus on what their goals are and to help them to see that maybe that they can, with, you know, if you like, one at a time, because that's another way of looking at single session help. That you can have a single session, you can go away, reflect, digest, put into practice, see what happens, come back and have another single session. But again, it's about utilization of resources. Now, in that situation, Kirsten, what are your choices? I would say that your choices are to offer an opportunity for that particular person to be seen quickly, and then rather than have them wait and wait and wait for a space for weekly therapy. If they wait for that space, their problems may become more acute, and therefore you would have not had the opportunity to help them at the point of need. But I'm not suggesting that single session therapy in any way is a panacea. What I am saying that it's a very good way of responding to help at the point of need, and then you have to look at what's available in the context in which you work. Would you rather, Kirsten, not offer a single session to that person until you have a space for ongoing weekly therapy? Or would you want to offer that person a single session, knowing that actually you don't know at the outset whether that person is going to benefit from a single session or not? So you may actually be asking them to wait for a long time for weekly therapy, and that person may have been able to have been helped within a single session framework. So it's about choices, how we utilize the resources that we have. My concern is particularly now with the tsunami, as Paul, that if we continue offering help on the basis of assessment, weight, and then therapy, we're not necessarily going to be helping a large number of people who may not need as much as we think they need.
Thank you, Wendy. Liz is asking, she thinks that this might be invaluable to people who need support moving forward after sexual assault. Do you have any information on that, or maybe any research data?
Well, I mean, I think the point is, after any particular assault or anything like that, the main focus is that we do not make judgments about what that particular person's pressing concern is, because we're looking at them as an individual rather than as a group of people under the heading of sexual assault. So I would say, really focus on that individual. Let's really take seriously what our counselling training says, which is respond to the individual as an individual, not within a category of problems, not within a category of actually situations that we experience, what they want to get out of help. And I think if you start with that, then that is a good illustration of single session mindset in action.
Thank you. Next question is from Monica, and I think it might be to Paul, because Paul is doing the initial assessments of the applicants. Do we need to be practicing to get to the training? I'm not quite clear what Monica means in terms of practicing, just practicing as a psychotherapist or practicing single session. But Paul, probably you can explain a little bit about the process.
Yeah, sure. The brief answer is it's not a crucial element of selection. However, what is a crucial element is that you have to have or already have a recognized core profession. Now, we've defined this in a fairly broad way. We've basically taken a list of core professions that is used by a particular insurance company, which is Oxygen. And what we basically said is that if you are within one of these core professions and that core profession is a talking based one, then yes, you can access the course. There is the assumption and the requirement that you also have either individual professional indemnity insurance, or alternatively, your employer provides that for you. So in brief, it's not crucial that you're practicing, certainly to come onto the course. And equally, when you do the second part of the course, which is CSST2, it is not crucial that you're practicing in that context either. But beyond that, when it comes to accreditation, then practice is crucial, but not for CSST1 and CSST2. But we do require you, please, to basically have a core profession which is talking based.
Yes, and the following question from Cashel about supervision after doing the training course. I believe supervision with Wendy is required for accreditation. So if you just
That's correct. That's correct. So the CSST Part 1 is a combination of online learning modules and live tutorials and also demonstrations with Professor Dryden. So it's a mixed training model, but it's primarily didactic. CSST2, which is the second part, is one which requires practice in pairs amongst individuals who are signed up for that. And then basically they will be required to do a demonstration with some feedback from Professor Dryden on that. It is recommended that individuals are not practicing with clients before that particular point is finished. So the recommendation is that client work using single session therapy is delayed until CSST2 is completed. From that particular point onwards, supervision is available from Professor Dryden as part of the ongoing process towards accreditation.
Okay, thank you. A question about the difference between solution-focused therapy and single-session therapy. Whoever wants to take it, Paul or Wendy.
I'm happy to take it because this is obviously an interest of mine. Do you want to go ahead, Wendy?
Well, I'll just firstly say that there are three ways of actually approaching single session work. One of which I don't advocate, and that is problem oriented. So the idea, if you approach this just focus on people's problems without solutions, then that's no good. But you can be problem and solution focused, or you can be solution focused. And I'm going to leave this to Paul to kind of spell out a little bit while I go and visit the facilities. Excuse me.
Right, thanks very much, Wendy, for that brief break. I think one of the most important things to emphasize about single session therapy work, which it's sort of one of those things that sometimes I feel I need to say 3 times because it's so central and it is so frequently misunderstood. Single session therapy is not a therapeutic modality. It's not a therapeutic modality. It is a mode of delivering therapy. And so for that particular reason, you can use single session work in a sense near enough whatever your modality background is. So you can use single session therapy as a CBT therapist, you can use it as a person-centered therapist, you can use it as a solution-focused therapist, you can use it as a psychodynamic psychotherapist. Now, there are certain elements within single session work which overlap to some degree with a number of other modalities, but it is not modality specific. It's a model of or a mode of delivering therapy. It is not a therapeutic, it's not a theoretical structure in itself. Now, there are some elements that Wendy has already mentioned, which will overlap with certain other modalities. He's mentioned it being strengths related. But can I just say, please don't assume that it is a solution-focused approach. And I think it's also important to emphasize that in most modalities that I'm familiar with, there is already a history of single session work. So if you take, for example, CBT, and I know that CBT was mentioned earlier on by somebody here, if you look at the work of Erst, for instance, all of Erst's work on phobias is single session work. Equally, you will find that in certain work that's conducted by David Milan, psychodynamic work is conducted as single session work. So it's not a modality specific way of working therapeutically. It's about taking the way of working that you are already trained in and familiar with, and which you probably gravitate towards, and discovering how you can use that within a new context, which is single session. So for that particular reason, as Wendy was saying, you can look at this as in connection with solution-focused work. For example, you can be solution-focused and be a single session therapist, but you can also be a single session therapist and not be solution-focused. It varies.
Thank you, Paul. Thank you. I will answer Laura's question about applying for training. You go to SDS website. It's www.skillsdevelopment.co.uk. I will type it in the chat box. And you go all courses and type Wendy Dryden in, and you'll find the course there to apply. couple of questions on the process, Wendy. There's a question from Louise about follow-up session. I know that we have a whole module dedicated to follow-up session, but in 2 words and 2 minutes, what can you say about the follow-up session?
Well, the purists say single session therapy should be 1 session and that's it, no preparation, no follow-up. I think in this day and age that is not defensible when you are trying to sort of interest various organizations in single session work. A very legitimate question is, well, how do we know that people are satisfied? How do we know it's effective? I think that really does require people at least to engage with the question of follow-up. So, and how you do that is really a matter of what the client thinks is important, what the therapist is important, what the organization thinks is important. So I think that if your organization has a particular viewpoint that all clients need to be followed up after a month, then all clients will need to be followed up for a month. If you take a more collaborative idea between the therapist and the client, you might say, well, look, I'd like to find out how things are going for you. At what point would you like to kind of feed back to me and actually have a particular opportunity for actually selecting a time frame from the client's perspective? But I really do think in this day and age, that's important. Now, having said that, we have walk-in therapy. Now, walk-in therapy, we don't have a tradition of that necessarily in Britain. They do in Canada, Australia, and America again. The idea that you walk in, you get 1 session of therapy from the get-go, you leave, you may not, you know, even give a particular address to be seen. And so I think that particular sort of way of working has to be respected. But basically, I'm in favor of follow-up because it really is saying, well, look, here's the evidence that, you know, that people have taken something productive from this session, put it into practice, and help them with their pressing concerns.
Thank you. An interesting question from Hannah. Isn't there potentially a tension between 1 session at a time and assessing, not assessing? Basically, the importance of assessment, I guess. I know you have quite strong views on that, Wendy.
Well, I mean, the point is, single session therapy is based on the idea of offering therapy at the beginning of a contact. Assessment is based on the understanding that we have to assess you in terms of what you are looking for, and we need to understand a little bit about that in context, and then we need to offer you something, you know, which is based on, you know, the research guidelines, which is fine. And again, I'm not knocking that. I'm not knocking that at all. But the point is, if you take that line, then a number of people may not stay the course and wait for that first session based on that type of traditional approach. So I do think, however, that it sometimes, and quite often actually, comes up as a result of a single session, whether or not somebody is going to require more. And so you have the interesting idea that maybe the best assessment is therapy rather than assessment. Now there's a thought.
Yes, actually, Jaswinder sort of echoes what you are saying, because she said that she actually lost clients because some of them were put off by the admin and assessment and all of that when all they wanted was help. So it happens. A quick question from Maria. Is the training counting towards CPD, and how many credits? The training is approved by British Psychological Society, and it contains 32 hours of CPD. Yes, it can be used for CPD purposes, and it is 32 hours for part 1, and then it's 2 days, so approximately 12 hours part 2, but just part 1 is 32 hours. The good thing about part 1, it is now, as Paul said, a mixed model. So we've almost finished the online part of the course, and the good thing about it that you can start it and do it at your own time. You are not attending at particular time and date. You're only attending tutorials at particular times, so it's much more flexible way of learning the online course.
Can I pick up on a question that I saw in the chat book by Louise, who asked the questions about what about risk, because I think that's a very frequently asked questions. My answer is this, that you deal in single session therapy with risk, matters of risk, in exactly the same way as you would deal with it in any other way of working with people. That if, you know, the risk has priority, and that the important thing is to help the person to stay safe within themselves and within the context of their social world, and that has to be kind of priority. So that's why I think the important thing is that single session therapy is best practiced within the context of an organization that actually facilitates that process.
A similar question from Jasvinda regarding risk assessment, and how do you deal with risk assessment and issues, and whether they're known to mental health services? How do you deal with that side of things?
Well, again, I mean, it depends upon what information that you gather, and the kind of context in which you work. I remember, for example, being a Samaritan many years ago, and we were often faced with a situation whereby people would call, and they were known to the organization, and therefore we responded to them partly because of that. Now, you can only respond to somebody kind of based on the information that you have. But I think that the danger is that you may be colored by the information, because that person may, in the moment, in the now, and the power of now is important, they may have a particular problem that you can help them with. And if you're overly colored by what's happened before, then that's problematic. However, if you're not mindful about what's happened before, that can also be problematic. So you're holding sort of like a difficult space, but you can only know what you know. And that is going to depend upon the context in which you practice single session work.
Thank you. Well, our 40 minutes are up, and I just wanted to say that Paul has shared the link to the course, and I've copied it again, the link where you can book the course and read a bit more about it. And don't forget, watch the first recording of the first session with Professor Dryden, because he talked much more about the processes within single session therapy in that first recording. And in your email, which you've received today, I've given you the link to all the recordings of our previous sessions, so do go and have a look at that. And thank you very much, Professor Dryden, as ever. It's lovely to see you. It's always interesting and very informative. And I hope to see you all on the 3rd of September for our next SDS Thursday. But for now, take care and enjoy the last summer days. See you.
Thank you very much. Bye-bye.
Thanks.
Bye.
Bye.
Bye, everyone.